Hello everyone and welcome to the presentation on the Master of Clinical Audiology. My name's Helen Goulias, I'm the Clinical Director of Audiology and I'll be speaking for the next 12 minutes, and then we have Shelley Lee, who's a past student, who will join us. Before I actually start the presentation, I'd like to acknowledge country. The University of Western Australia acknowledges that its campus is situated on Noongar land and that Noongar people remain the spiritual and cultural custodians of their land and continue to practice their values, languages, beliefs and knowledge. The Master of Clinical Audiology course has been running at UWA for 20 years this year. The three main teachers on the course include me at the top, Dr. Helen Goulias, Associate Professor Helmi Moulders and Dr. Robin Choi in the photo at the bottom. And our email addresses are there, and we're very happy and welcome any questions that you may have. Most of you, I guess, are looking at audiology as a potential career. And audiologists are the health professionals who work in the prevention, the diagnosis and rehabilitation of people with hearing and balance disorders. And that includes ear disease, vestibular disorders and tinnitus, which is a perception that you hear in your ears that no one else can hear. Basically, if you want to be an audiologist, it's because you want to be in a helping profession, and the Master of Clinical Audiology provides you with the knowledge and skills to do so. Some of you might have some idea about what audiologists do and may have already been to an audiologist in your lifetime. The most common time people go is when they're younger, under 5 years of age, and they might have had a series of ear infections, and it's the audiologist that's been doing their hearing testing and management. Later on in life, as you get older, people tend to go to audiologists because you lose your hearing as you get older, and audiologists help them manage their hearing at that point in life. And of course, there's the wealth of people in between those that are 5 and those that are in their 70s and 80s who might have an ear disease or an ear operation or lost their hearing suddenly as a result of an accident, and they come in contact with an audiologist. But if you haven't seen an audiologist yet, then what you will realise if you do the audiology course is that most audiologists work in clinical settings with patients and all clients. We use the term patients to refer to people in hospitals and medical centres, and clients in the non-medical setting. Audiologists test their hearing and they may test their balance function. They might prescribe and fit hearing aids and or cochlear implants. They provide tools and counselling for hearing and balance disorders. And they work with other professionals who might include ear, nose and throat surgeons, neurologists, paediatricians, speech pathologists and teachers. Some audiologists work in research settings and in research and development of new tools and devices. And that might be with the universities and research institutes, or it might be with the hearing instrument manufacturers. Some of you might be aware that one of the biggest manufacturers in Australia, well, not so much manufacturers, but providers of devices in Australia is Cochlear Corporation, based in Sydney, and they employ a number of audiologists. So where do audiologists work? Well, they may work in the public and private sectors with adults or with children. And the two photos on this particular slide show on the left-hand side an audiologist testing the hearing of an adult, and on the right-hand side an audiologist testing the hearing of a child. And when a child is under about 5 years of age, but older than about 3 years of age, so between 2.5 to 5 years of age, we teach them to show us that they've heard a sound by doing a game like putting a peg in the board. Audiologists work in schools and hospitals performing electrophysiological and behavioural tests. So in this particular case, the photograph on the right-hand side is a behavioural test, and that looks like about an 18-month-old, and he's being shown to look for a puppet in a box when he hears a sound. And so we can train a toddler, and in fact we can train children from about 5 months of age to search for a sound and be rewarded by something like a puppet in the window. Younger children, and when we need more complex testing, might be tested electrophysiologically, and that involves putting a set of electrodes on the head, making some sounds and measuring the electrical activity of the auditory pathway. Other audiologists work in rehabilitation with hearing aids and cochlear implants. And hearing aids on the left are an acoustic device, and they simply collect an acoustic signal, turn it into an electronic signal, process the sound, and then turn it back into an acoustic signal that's amplified and heard. Whereas the cochlear implant on the right-hand side will search for a signal, an acoustic signal, change it into an electronic signal, and that electrically stimulates an implant that's implanted within the cochlea, the inner ear. Excuse me. Audiologists might work in newborn hearing screening programs. And here is a newborn baby. And like an earlier photograph, newborn hearing screening is performed using an electrophysiological technique, and the audiologists don't do the testing themselves. There are people trained to do that, but it would be the audiologists that manage the program. Audiologists might work in rural and remote communities, including Indigenous communities, helping to prevent and treat ear disease and deafness. And the photo on the right is one of our former students who's now working as an audiologist, and she was working with Earbus Foundation on that particular trip, testing children in Indigenous communities. And that's because the prevalence of hearing loss in Indigenous children is amongst the highest in the world, and we need many audiologists in Western Australia in particular. Some audiologists, but not many, work in industrial settings, in noise management and hearing conservation. And they're involved in assessment of noise levels, in monitoring of hearing testing, in helping companies work out what needs to be done to reduce noise levels in their workplace. So audiology is quite widespread in its scope of practice, and audiologists can work with a wide range of clients in a wide range of industries. In terms of the pay and conditions, the career prospects at the moment are excellent. Most UWA graduates have a job within 3 months of graduating. And up until COVID, I used to be able to say all graduates had jobs within 3 months of graduating. But COVID slowed things down for some of our graduates last year. There's still a couple of them who are looking for jobs, but then they've also been specific in wanting the metropolitan area. I think even with COVID, the job prospects are excellent. Most of our graduates have offers before they, in fact, finish their final exams at the end of the second year. Starting salaries vary depending on where you work, so you can expect to get somewhere between $62,000 and $72,000 per year, plus superannuation and other extras when you first start. And your first year is a clinical internship year, and that is a paid internship with an employer. Mid-career, you can expect somewhere between 95 and 110, and at the top, audiologists get above 140,000. Where do you work? Well, you can travel as much or as little as you like. The more specific you are about where you work, the more difficult it might be for you to get exactly what you want, because often travel is required for many positions. There are some people that just want to work in city and suburban centres, Others really want to do rural and remote work, and I myself have travelled in my career through Broome, Thursday Island, Yuendamu and King Island. Or you might want to work around the world, and generally that is in English-speaking countries. But audiologists, Australian graduates, are highly sought after in Switzerland, Denmark and Germany, where the hearing aid manufacturers are. So if you do work internationally, many audiologists go out to the United Kingdom, particularly in the area of paediatrics, and they work with the National Health Service. Canada employs Australian audiologists, especially in hospitals and deaf schools. And in Europe, as I mentioned before, some of the big hearing aid manufacturers, including Phonak, Bernafon, Oticon, G&R Resound, Widex, Sivantos and Medel, employ Australian audiologists. In Southeast Asia, Cochlear Corporation employs audiologists, but they're also employed in hospitals and community work. And then there is a whole lot of work in developing countries which have very few, if any, audiologists. And how do you become an audiologist? Well, you need a good undergraduate degree. UWA accepts a WAM of 65 minimum. However, it's a competitive course. In the 2020 intake, the lowest WAM was 73. You need to demonstrate an interest in working in audiology. You need to have good communication skills, and above all else, you need to enjoy spending most of your time with people. So you complete the Master of Clinical Audiology at UWA, and the course is accredited by Audiology Australia. And we encourage you to meet audiologists who are out in the workplace. And I've left the link to Audiology Australia there, and they will give you a list of a service directory where you can call a clinic and arrange a visit to see what audiologists do. UWA's program is only one of 6 programs. It's spread across 2 years, 4 semesters, and each semester has 4 weeks full-time lectures, 2 weeks full-time clinical intensive, and then a 10-week period of external clinical placements in clinics around WA. You then have a week off to study, a week of written exams, a bit of a break, and the cycle repeats itself. The limiting factor for our accepting low numbers of students is clinical placements. Every student gets to be in clinics for 500 hours across the 2 years, and the clinics are rotational depending on where you are at, and can be in the Perth metro area, interstate or overseas. The course has got 16 units in total, with Year 1 focusing on the fundamental sciences and the introductory audiology clinical units, and some pathophysiology and electrophysiology, and of course speech, language and communication. Year 2 includes the practice management unit, the professional practice units, and much more advanced studies in audiology, and it also includes the research projects, which comprise 1/4 of the second year. The clinical placements and clinical exams are spread across the 2 years of the course. And the next few slides show you what a great time our audiology students have. And these are all students from the past doing activities that we would expect everybody to be involved in throughout the course. You saw paediatric testing, adult testing, students going out to the outback as far as Narble Bar, with various organisations. And that's me, having worked in Africa, in Malawi, and me working in Indonesia. So thank you for your attention. I can see there are some Q&As, but before I start to answer them, I'll hand you over to Shelley Lee, who is a graduate and has very kindly agreed to talk to you for a few minutes. Hi, Shelley.
Thanks, Helen. Just wanted to check, can you hear me? Can everybody hear me? Perfect. Thanks for inviting me today. It's a little bit late where I am, 9 p.m, but I'll try to stay awake during this course. But thank you for coming, everyone. I remember starting in your position not too long ago as well. I started my Bachelor of Science in Neuroscience actually, and I graduated in 2015 with that. And it was really in my second year of neuroscience where I wasn't really sure what profession I would be looking at as a career pathway. And I knew that I really wanted to go into healthcare and allied health. And the option for me that stood out at the time was actually the Master of Pharmacy. And that's actually what I started pursuing initially. So I had a job as a pharmacy assistant for quite some time, and that's when I really got to have hands-on experience in healthcare. And I realized I really enjoyed certain aspects of pharmacy, but I couldn't see myself being a community pharmacist. So I really tried to pull myself together and have a bit of a brainstorm session and figure out what aspects of healthcare I was really interested in. And I realized it was the one-on-one interactions and building those relationships that I really enjoyed on the job, and seeing the regular customers at the time come in. It was great to kind of see their progress as well, and see them every time. And I think it was that instant gratification that I really enjoyed on the job. So that was when one of my friends recommended audiology to me. And before that, I really didn't know very much about audiology. I think the only thing I knew about audiology was a link to hearing aids, and that's about it. So I started doing a bit of research into audiology, and I thought, why not apply? So I applied, and luckily I got a spot in audiology, and I went on to study audiology immediately afterwards in 2016. So I started with a cohort of 30 people, and as Helen mentioned, is a very small cohort, but I really enjoyed that actually, because you get to build a really close bond with your cohort, and a lot of them I'm still in touch with now, and that's where I got to build a lot of my close friendships actually as well. And one thing I really enjoyed about the course was actually the structure of it. So initially when I started the course, you get given an intensive 5-week period of theoretical learning, and it was quite intensive. And it was a bit of a revision on physics, which I didn't expect, and a whole new learning into the clinical side of it as well. But that really paid off when I started to go into my clinical learning and my practical placements as well, because I actually got to apply what I learnt in the classroom to real life. And you actually get to see how you can apply the theories and the knowledge you learn in the classroom to a clinical setting. And I think that's what's really rewarding about the course. And one of the things I really enjoyed about the course as well was the placements that I had. So every semester I was placed in a new regular clinic where I was with a new supervisor in a new clinic and organisation, and I really got to explore the different sides of audiology because of that. I think not a lot of people are aware, but there are a lot of different avenues in audiology, and it's not just hearing aids and adult rehabilitation, which you might see across the suburbs and in Perth. It's a lot of avenues that people haven't really explored yet when they're looking to audiology as a career option. But I've had the opportunities to explore lots of different career paths after I graduated. So in my second year of audiology, that's when I started looking for jobs, but it actually worked the other way around. It was actually the employers who came out and reached out to us and organised essentially functions and dinners for us to get to know us as a cohort, to recruit us actually. So I don't think that happens to a lot of professions, but luckily audiologists are in high demand, especially in WA. And so I think that year 26 out of the 24 out of the 26 who were graduating landed a job before they graduated, and the 2 who didn't land a job before they graduated secured a job within 2 to 3 months of graduating. So that was a really great outcome. And the role that I got was with a company called National Hearing Care. and that's where I did my clinical internship for a year. And initially, I think I was a little bit disappointed actually, because I wanted to go into diagnostic audiology, and it wasn't the initial field I was interested in. But I made the most out of my opportunity there, and I actually learnt a great deal about audiology from that company, and they provided me with a lot of great training. And I was able to go interstate to Sydney and Melbourne for training, and I went to work in Busselton for a little bit as well. And so I was able to see a lot of aspects of audiology there. But after I completed my internship, I decided I really wanted to pursue diagnostic audiology. And that's when I joined another company called Attune Hearing. And they specialize in vestibular audiology, which Helen mentioned before. And it's really about treating balance and dizziness disorders, which I was initially very interested in and very passionate about. And you really have to revise your physiology of the ears and vestibular organs for that. And it was very challenging and very different to your normal standard adult rehabilitation in clinic. So that's where I also got to work in a multidisciplinary team as well, with ear, nose and throat specialists and nurses as well, to treat a lot of the pediatric population. And that's where I got to see more of a primary care side of audiology as well. So I got to see a lot of glue ear, which you've probably heard of as well, and a lot of middle ear diseases there as well. But after that, I decided to take another avenue in audiology, and here I am now in my new role. I'm actually working for the Department of Health in Canberra at the moment, and I'm working as a clinical program manager for the Hearing Services Program. So that is the program that looks after Australians living with hearing impairments and hearing difficulties or communication difficulties in Australia. And it's a very large program, and it's very interesting to see what's happening behind the scenes, I suppose. It's a very different role to my clinical roles. I don't get that instant gratification that I do from my patients and my clients. But what I do get is I look at legislations really and policies to see how that impacts on the industry as a whole. And so there are lots of different avenues of audiology, and the initial reason I joined audiology was to genuinely help people and help people hear really and communicate, improve their quality of life as well. But I think I've explored a lot of different avenues of audiology, and I think what I realized was there's something in it for everybody, and my goals and my needs have changed throughout my career, and audiology is still able to meet those needs as well. And I think if you're interested, and if you have a genuine interest in helping people, and if you really do like spending time with people as well, audiology is a really great avenue for you to look at. That's it from me.